The thyroid is a small gland located in the neck, just below the Adam's apple. It is part of the endocrine system, which is responsible for producing and regulating hormones in the body. The thyroid gland produces two important hormones, thyroxine, T4, and triiodothyronin, T3, which are involved in regulating metabolism, growth, and development. These hormones play a crucial role in many bodily functions, including heart rate, body temperature, energy levels, and weight management. When the thyroid gland produces too much or too little of these hormones, it can cause various health problems, including hyperthyroidism and hypothyroidism. Difference between hyperthyroidism and hypothyroidism. Hyperthyroidism and hypothyroidism are two conditions that affect the thyroid gland and can have different symptoms and causes. Let's talk about hyperthyroidism first. Hyperthyroidism, this condition occurs when the thyroid gland produces too much thyroid hormone. Some common causes of hyperthyroidism include Graves' disease, toxic nodular goiter, and thyroiditis. Symptoms of hyperthyroidism can include weight loss, rapid heartbeat, sweating, nervousness, irritability, and trembling hands. Treatment options for hyperthyroidism may include medication, radioactive iodine therapy, or surgery. Hypothyroidism, this condition occurs when the thyroid gland does not produce enough thyroid hormone. Some common causes of hypothyroidism include autoimmune disorders like Hashimoto's thyroiditis, surgical removal of the thyroid gland, and certain medications. Symptoms of hypothyroidism can include fatigue, weight gain, cold intolerance, dry skin, hair loss, and depression. Treatment options for hypothyroidism may include thyroid hormone replacement therapy. It is important to note that both hyperthyroidism and hypothyroidism can have serious health consequences if left untreated, and individuals who suspect they may have a thyroid problem should seek medical attention. Causes of thyroid. There are several causes of thyroid problems, including autoimmune disorders. In some cases, the immune system can attack the thyroid gland, leading to conditions such as Hashimoto's thyroiditis, hypothyroidism, and Graves' disease, hyperthyroidism. Iodine deficiency. The thyroid gland needs iodine to produce thyroid hormones. A lack of iodine in the diet can lead to an enlarged thyroid gland, goiter, and hypothyroidism. Radiation therapy. Exposure to radiation, either through medical treatment or environmental exposure, can damage the thyroid gland and lead to hypothyroidism. Medications. Some medications, such as lithium and amiodarone, can interfere with thyroid function and lead to hypothyroidism or hyperthyroidism. Congenital disorders. Some babies are born with an underdeveloped or absent thyroid gland, leading to congenital hypothyroidism. Thyroid cancer. In rare cases, thyroid cancer can develop, which may require surgery or other treatments that can affect thyroid function. It's important to note that in many cases, the exact cause of thyroid problems is not known, and a combination of factors may be involved. Regular checkups and monitoring of thyroid function can help detect any issues early and prevent serious complications. Symptoms of thyroid. The symptoms of thyroid problems can vary depending on the type and severity of the condition. Here are some common symptoms of thyroid problems. Hyperthyroidism, overactive thyroid. Rapid heartbeat. Weight loss. Anxiety or nervousness. Tremors or shaking hands. Increased sweating. Difficulty sleeping. Changes in bowel patterns. Eye problems, in Graves' disease. Hypothyroidism, underactive thyroid. Fatigue or weakness. Weight gain. Sensitivity to cold. Dry skin and hair. Constipation. Depression. Joint pain or stiffness. Decreased heart rate. Goiter, enlarged thyroid gland. Visible swelling in the neck. Tightness or pressure in the throat. Hoarseness or difficulty speaking. Difficulty swallowing. It's important to note that some people with thyroid problems may not experience any symptoms, while others may experience symptoms that are not listed here. If you are experiencing any unusual symptoms, especially those related to the neck or throat, it's important to see a healthcare professional for an evaluation. Natural treatment for thyroid. While there is no cure for thyroid problems, there are natural treatments that may help manage symptoms and improve thyroid function. Here are some options. Healthy diet. A balanced diet that includes plenty of whole foods, fruits, and vegetables can provide the nutrients necessary for thyroid function. Additionally, avoiding processed foods and limiting sugar and caffeine intake can help regulate hormone levels. Exercise. Regular physical activity can help boost metabolism and energy levels, and may improve mood and reduce stress levels. Stress management. Stress can have a negative impact on thyroid function, so practicing stress-reducing techniques such as meditation, yoga, or deep breathing can be beneficial. Supplements. Certain supplements, such as iodine, selenium, zinc, and vitamin D, may support thyroid function. However, it's important to consult a healthcare professional before taking any supplements, as some can interact with medications or cause adverse effects. Herbal remedies. Some herbs, such as ashwagandha, gugul, and bladderwrack, may have beneficial effects on thyroid function. However, as with supplements, it's important to consult a healthcare professional before using any herbal remedies. It's important to note that natural treatments should not replace medical treatment for thyroid problems, and that any treatment plan should be discussed with a healthcare professional. Foods to avoid in thyroid. Certain foods can interfere with thyroid function or medication absorption, so it's important for people with thyroid problems to be mindful of their diet. Here are some foods to avoid or limit. Soy products, including soy milk, tofu, and edamame, contain compounds that can interfere with the absorption of thyroid hormone medication. Gluten. Some people with thyroid problems may also have celiac disease or gluten intolerance, so avoiding gluten-containing foods may be beneficial. Cruciferous vegetables. Vegetables such as broccoli, cauliflower, cabbage, and kale contain compounds called goitrogens that can interfere with thyroid function when consumed in large amounts. However, cooking these vegetables can reduce their goitrogen content. High fiber foods, such as whole grains, beans, and lentils, can interfere with the absorption of thyroid medication when consumed in large amounts. Sugary and processed foods. Sugary and processed foods can disrupt blood sugar levels and may interfere with thyroid function. It's important to note that while avoiding these foods may be helpful for some people with thyroid problems, everyone's dietary needs are different, and it's best to work with a healthcare professional to develop a personalized dietary plan. Foods to eat in the thyroid to treat it. There is no single food or diet that can cure thyroid problems, but a healthy, balanced diet that includes nutrient-dense foods can help support thyroid function and overall health. Here are some foods that may be beneficial for people with thyroid problems. Iodine-rich foods. Iodine is essential for the production of thyroid hormones, so including iodine-rich foods in the diet, such as seafood, seaweed, and iodized salt, can be beneficial. Selenium-rich foods. Selenium is another mineral that is important for thyroid function. Foods rich in selenium include Brazil nuts, seafood, and organ meats. Vitamin D-rich foods. Vitamin D plays a role in thyroid function and can be found in fatty fish, eggs, and fortified foods. Omega-3 fatty acids. Omega-3 fatty acids found in fatty fish, flaxseed, and chia seeds may help reduce inflammation and improve thyroid function. Fruits and vegetables. A diet rich in fruits and vegetables can provide the nutrients necessary for optimal thyroid function, including vitamins A, C, and A, as well as fiber. It's important to note that any dietary changes should be made in consultation with a healthcare professional, as some foods and supplements can interact with medications or have adverse effects.